from whatever you have said, Shamika, are we doing enough? Again, the very fundamental question.
No, that's I don't think any country, Sanket, can say we have done enough. Now, let me give you some specific examples on where I think the government, look, this is really going to take every arm of society. Government is a very large part of it. But I think, we are all sitting and working from home now 6th month. So people are doing their bit too. Local institutions, communities have to play. The community leaders have to play a very large role. But I think at this point, it's important to highlight the fact that we are not getting enough information. I think communication by local government and central government can be much better.
Very interesting dimension.
We are still talking about Johns Hopkins national level statistics.
Yeah.
We should know by now what is the gender component to mortality. What is the age adjusted mortality? What is the incubation period in India? What are the comorbidities which are particularly debilitating? In 6 months we have enough patient level data and hospitalization data to put out statistics of this nature, which is very important to assuage fear.
Raghav, let me come to Raghav now. Raghav, if you heard what Shamika said, I mean, the best performing states are now also facing the problem of a resurgence of this virus. Similarly, while Delhi celebrates early success, do you think that you can't really be in a celebratory mood so long as all our population is properly vaccinated, as and when that vaccine comes?
No, there is no question of celebration. I mean, one should celebrate only when we reduce the mortalities in Delhi to 0. And I, at the very outset, said that it appears that the Delhi model of Arvind Kejriwal has boxed out COVID-19 in round 1 of this boxing match. There would be a subsequent round. There would be a round 2, round 3, round 4. And we are gearing up for that. And therefore, we cannot let to lower our guard. I mean, that's certainly the principle which we are following. Number one. Number two, it's a combination. When you talk of states like Maharashtra, Andhra and others, it's a combination of political will and financial resources. Of course, in Delhi, one has tried to demonstrate sheer political will and the might of the civil administration to control the outbreak of COVID-19. And I think various states across the country should actually take a leaf out of the Delhi model's book.
I think, Sanket, my friend Raghav is saying that we are supporting each other. On one hand, he is saying that we are supporting each other. They are matter of the both hands only. Honorable Home Minister Shri Amit Shah ji take a meeting with the Chief Minister Shri Arvind Kejriwal ji and do the final decisions to make condition better in the Delhi. So many supports, good support they give to government of Delhi, state government. And instead of all these things, they are again just coming on that they are only doing home isolation is their policy only. Good. Yeah. Please, do not bring all these things, this advocate or lawyer, whatever, that they refuse the cases. So I think
there are so many.
Just give me 30 seconds.
One moment. I have to intervene here, running out of time. See, many important issues that require political intervention immediately. Now, there was a point mentioned by Dr. Rajoria that...
We should appreciate...
Yes, Dr. Rajoria mentioned a crucial point. Supriya, very quickly, Dr. Rajoria mentioned a crucial point that the Prime Minister has inaugurated. He has unveiled new facilities for the more robust RT-PCR testing. But then you've got a whole problem of antigen tests. I mean, we may be adding a lot of numbers in terms of testing, our testing capability with these antibody quick test kits. But they produce false negatives, thus giving you a notion that all is well.
No, Sanket, I think you have to clarify a few things here. First of all, the daily new numbers in Delhi are coming down. There's no two ways about it. So I think Delhi has done a very good job of containment.
Sure. Absolutely.
However, the mortality in Delhi, imagine all India is 26
No,
deaths per
Shamika,
million.
I'm not just concerned about Delhi alone.
The virus has claimed its pound of flesh.
See, this virus is now moving inwards.
By the way, in Delhi, our death rate is more than 200 deaths per million. So we've had our share of
okay, Supriya.
Mortality.
Supriya, very quickly. The point on...
I am just going to say a very brief point, and I think the government needs to get out of event management, headline chasing, and really chase this virus to its logical end. I just think there's too much surround sound. We did Thali. Look at what is happening to the doctors. There are reports of how some of these medical practitioners who lost their lives haven't even got the compensation that they were promised. So I think we need to get real. We need to forget headline and event management and really get down to doing the job.